is something called vaccine alarmism, preventing people from getting the COVID-19 vaccines. People hear that the vaccines aren't 100% effective, or that even if you are vaccinated, you could still be contagious, and that the variants may make things worse, so we shouldn't change our behavior. Well, that leaves some people with the attitude of, why bother then? So joining us now to talk about this is Dr. Kate Grabowski. She is an epidemiologist at Johns Hopkins. Thank you for joining me, Dr. Grabowski. Appreciate you joining us.
Thank you so much for having me. It's a pleasure to be here today.
Well, let's just start with the messaging, because obviously there's some problems here. What's wrong with our messaging when it comes to vaccines?
Well, I think, you have to remember we're scientists. We're always very careful about what we say. We're not trained in public communications. And so sometimes when we're communicating uncertainties about minor points, those get misconstrued as major roadblocks when in fact I don't think that they are. So let me just start by saying that we are certain and very confident about a couple of things when it comes to the vaccines. We are very, very confident that they are safe. We know from many clinical trials now that these vaccines are safe to take. We also know that the vaccines are very effective against severe disease. So this includes all three vaccines, the Moderna vaccine, the Pfizer vaccine, Johnson & Johnson, which are all green lighted under the EUA program by the FDA. All of those vaccines are safe and highly effective against severe disease, including hospitalization and death, which are our most important outcomes in moving forward. So if we can reduce hospitalizations and we can reduce deaths, we can reopen and start to return to normality.
Do you think vaccines are kind of the new masks that have been politicized as a protective measure against COVID-19? Is that what we're experiencing as well?
I hope not, and I don't think that they should be. There really are great hope in moving past this pandemic. So I know that there is a big concerted effort by the anti-vaccine community, and I think we all need to be vigilant about misinformation that's being spread by these groups. So I hope not. I don't think so yet, and I think we need to avoid that if possible. And one of the things we need to do is be vigilant about this anti-vaccine information that's being spread by these groups.
Okay, so let's talk about that, because many people say they don't want to get the vaccine, partly because it's not 100% effective. There are estimates that nationwide, nearly half of Americans will actually refuse a shot if offered one immediately. There are misconceptions. Some people are saying, well, I'm not going to get it. There's these chips that are inside the vaccines that they're trying to, have a government control over us. So much false information. Many military people have said they're not going to get it either. What needs to be done to turn this around?
So let's take all of those point by point. So first of all, the vaccines are very effective. They are more than 95% effective against severe disease, including hospitalization and death. That is amazing. And I think it's important to keep in mind that people of all ages and all health statuses can die from COVID-19. So we know that there are some people at higher risk, older individuals who have diabetes and other pre-existing conditions, but there are people who are very healthy that sometimes get this disease and die anyway. So I think that's been one of the issues of people taking up the vaccine, particularly in younger age groups who don't perceive themselves to be at particularly high risk. I think when we talk about effectiveness, it's important again to emphasize that the effectiveness was really the measurements against severe disease and death. There's been some uncertainty about how effective the vaccines can be in preventing actual acquisition and transmission of the virus. So the concern was, well, maybe you can still get the virus, but just have a very mild case or a very asymptomatic case. But we have lots of emerging data now, both from the clinical trials and also from real world settings like Israel. The vaccine is highly effective against preventing infection and transmission of disease.
Okay.
So I think there was a little bit of uncertainty there, and it got kind of blown up.
Okay.
I do think we need to be a little bit worried about the variants, but remember that the reason that this virus is so dangerous is because it's novel. And the vaccines prime our immune system. And once we have that prime, we are no longer experiencing a novel disease anymore.
Yeah.
So while we might still get sick in the future, likely to be less severe.
Okay, final question for you. What's the magic number we need to reach herd immunity, and when do you think we can reach that?
Uh, I mean, that's a very difficult question to answer. A lot of it depends on what the background rates of infection have been in the communities prior to that. We know there's a lot of heterogeneity in the United States. There are some communities where we have 40 or 50% of people who have already been infected, and some communities where less than 10% of people who have been infected with COVID-19. So how much we need to vaccinate people to get to those thresholds that would reduce transmission really depends on where you are and what the local situation has been. I think really what we need to see are those hospitalization and death rates starting to come down precipitously. We've seen some declines, like some really exciting declines in cases and hospitalizations and deaths over the last month. Those seem to be plateauing a little bit, but I'm hopeful that as we continue to roll out the vaccine and as people take it up, that we will be able to move forward.
Well, we certainly all hope that those death rates do fall. We do appreciate you guys have done some amazing work during this pandemic, so we thank you for coming on and sharing your perspective. Great to meet you. Thanks again.
Thank you so much. It was great to meet you, and thanks for having me on.